Today, we're delving into a topic that's vital for many of us: kidney health. If you're searching for ways to enhance your kidney function and overall wellness, you're in the right place. In this video, we'll explore how a well-balanced diet, managing your acid-base equilibrium, and making informed decisions about supplements like sodium bicarbonate can make a substantial difference. Remember, it's all about taking proactive measures and collaborating closely with your healthcare provider. Stay tuned for practical tips and expert insights that can help you maintain your kidneys in optimal condition. Importance of diet in kidney health. You can significantly enhance your kidney health through diet. Focusing on a well-balanced diet that is lower in protein and limits processed foods, dairy, meat, and sugary beverages is crucial. The National Institute of Diabetes and Digestive and Kidney Diseases recommends a renal diet to help manage kidney disease. Diet plays a pivotal role in maintaining and improving kidney health. A well-balanced diet can profoundly impact your overall well-being, especially if you are managing kidney disease. The primary objective is to reduce the burden on your kidneys by carefully selecting the types of food you consume. A renal diet, as recommended by the National Institute of Diabetes and Digestive and Kidney Diseases, emphasizes lowering protein intake and avoiding processed foods, dairy, meat, and sugary drinks. Protein, while essential for body function, can be taxing on the kidneys when consumed in large amounts. Proteins break down into waste products that the kidneys must filter out, which can be particularly challenging for those with impaired kidney function. Therefore, moderating protein intake by choosing plant-based proteins or lean meats in small quantities can help reduce this burden. Processed foods, on the other hand, are typically high in sodium, preservatives, and other additives that can increase blood pressure and further strain the kidneys. By cutting down on processed foods, you help maintain better blood pressure levels and reduce the risk of further kidney damage. Examples of kidney-friendly foods. For instance, replacing a processed snack with a piece of fresh fruit like an apple or a handful of berries can significantly lower your intake of harmful additives and provide essential nutrients. Similarly, dairy products and meats are often high in phosphorus and potassium, which need to be monitored in people with kidney disease to prevent complications such as hyperkalemia, high potassium levels, and hyperphosphatemia, high phosphorus levels. Sugary drinks, including sodas and certain fruit juices, contribute to high blood sugar levels and can lead to diabetes, a leading cause of chronic kidney disease, CKD. Opting for water, herbal teas, or beverages with no added sugar can help in maintaining healthy blood sugar levels. By focusing on a diet rich in fruits, vegetables, whole grains, and lean proteins, you can better manage kidney disease. Foods like berries, apples, cauliflower, and fish such as salmon and tilapia are beneficial as they are low in sodium and potassium, but high in essential nutrients. These foods help in providing the body with necessary vitamins and minerals without overloading the kidneys. In conclusion, improving kidney health through diet is not just about what you avoid, but also about what you include. Embrace a kidney-friendly diet and consult with a healthcare professional or a dietitian to tailor your dietary choices to your specific needs. Remember, small changes in your diet can lead to significant improvements in your kidney health. Acid-base balance and kidney health. The video discusses the concept of an alkaline diet, highlighting the importance of understanding the body's regulation of acid-base balance. According to the Mayo Clinic, the idea of an alkaline diet has gained traction in various health circles, suggesting that consuming foods that produce an alkaline effect in the body can improve health and prevent diseases, including kidney disease. However, it's essential to comprehend how the body regulates acid-base balance and what current research says about the efficacy of such diets. How the body regulates acid-base balance. The human body maintains a tightly regulated acid-base balance, typically keeping the blood's pH level between 7.35 and 7.45. This balance is crucial for normal bodily functions and is managed through various mechanisms involving the lungs, kidneys, and buffer systems in the blood. The kidneys play a vital role by excreting excess acids or bases to maintain this balance. The idea behind the alkaline diet is that consuming alkaline-forming foods, primarily fruits and vegetables, while avoiding acid-forming foods like meats, dairy, and processed foods, can help maintain this balance and thereby improve health. Proponents argue that an alkaline diet can reduce the risk of chronic diseases, including kidney disease, by reducing the acid load on the kidneys. However, according to the Mayo Clinic and other medical experts, there is limited scientific evidence to support the direct benefits of an alkaline diet specifically for kidney disease. The body's regulatory systems are highly effective at maintaining pH balance regardless of dietary intake. While it is true that certain foods can produce acid or alkaline residues after metabolism, the overall impact on blood pH is minimal because the body compensates through its regulatory mechanisms, aligning alkaline diet principles with kidney health. That said, the principles of an alkaline diet do align with general dietary recommendations for kidney health. Emphasizing fruits, vegetables, and whole grains, and limiting processed foods, red meats, and high-phosphorus foods can be beneficial. These dietary choices can help manage blood pressure, reduce inflammation, and improve overall nutritional status, which are critical factors in managing kidney disease. Moreover, some studies suggest that reducing dietary acid load may help manage metabolic acidosis, a common issue in advanced kidney disease. Metabolic acidosis occurs when the kidneys are unable to excrete enough acid, leading to a buildup in the blood. By reducing the intake of acid-forming foods, patients may alleviate some of the symptoms associated with this condition. In summary, while the concept of an alkaline diet may not directly impact blood pH levels due to the body's robust regulatory systems, the dietary recommendations it promotes can still support kidney health. It's always best to discuss any significant dietary changes with a healthcare provider to ensure they align with your specific health needs. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment great to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. Potassium and your kidneys. The video mentions high potassium intake as a concern for some with kidney disease. This is true, but it's important to note that most healthy adults get enough potassium through a balanced diet and may not need restrictions unless advised by their doctor. Potassium is an essential mineral that plays a critical role in maintaining normal cell function, particularly in the heart and muscles. However, for individuals with kidney disease, managing potassium intake becomes crucial due to the kidney's reduced ability to excrete excess potassium, which can lead to hyperkalemia, a potentially dangerous condition characterized by high levels of potassium in the blood. Managing potassium intake. For most healthy adults, potassium intake is not a significant concern, and a balanced diet typically provides an adequate amount of this essential nutrient. Foods rich in potassium, such as fruits, vegetables, legumes, and dairy products, contribute to various bodily functions, including nerve transmission, muscle contraction, and fluid balance. In the context of kidney disease, the situation is different. As kidney function declines, the ability to excrete potassium diminishes, leading to the risk of hyperkalemia. Symptoms of hyperkalemia can include muscle weakness, fatigue, irregular heartbeats, and, in severe cases, cardiac arrest. Therefore, monitoring and managing potassium intake becomes a critical aspect of dietary management for those with advanced kidney disease. The National Kidney Foundation and other health organizations provide guidelines on potassium intake for individuals with CKD. These guidelines emphasize the importance of personalized dietary plans based on the stage of kidney disease and individual health conditions. For patients with early-stage kidney disease, potassium restriction might not be necessary, and they can continue to consume potassium-rich foods under medical supervision. However, for those with advanced CKD or those on dialysis, stricter control of potassium intake is often recommended. It's also important to note that dietary potassium is not the only factor influencing blood potassium levels. Medications, fluid intake, and other health conditions can also impact potassium balance. Hence, Regular monitoring through blood tests is essential to ensure potassium levels remain within a safe range. Dietary adjustments for potassium. For those who need to limit potassium intake, dietary adjustments can be challenging but manageable with proper guidance. Strategies include choosing lower potassium fruits and vegetables such as apples, berries, grapes, and green beans, and avoiding high potassium foods like bananas, oranges, tomatoes, and potatoes. Additionally, cooking methods such as boiling can reduce the potassium content in vegetables. For example, boiling potatoes and discarding the water can significantly lower their potassium content, making them safer for consumption. In conclusion, while the general population can benefit from potassium-rich foods, individuals with kidney disease must carefully manage their intake to avoid complications. Always consult with a healthcare professional or a dietitian to develop a personalized dietary plan that meets your nutritional needs while protecting your kidney health. Sodium bicarbonate, baking soda. The video suggests sodium bicarbonate, baking soda, as a supplement. This can be helpful in some cases, but consult your doctor first. The National Kidney Foundation advises against using baking soda without doctor supervision due to potential side effects. Sodium bicarbonate, commonly known as baking soda, is sometimes recommended as a supplement for individuals with kidney disease, particularly for managing metabolic acidosis. Metabolic acidosis is a condition characterized by an excess of acid in the blood, which can occur when the kidneys are unable to adequately remove acid or when the body produces too much acid. Sodium bicarbonate can help neutralize this excess acid, potentially slowing the progression of kidney disease and improving overall health. Studies have shown that sodium bicarbonate supplementation can be beneficial for patients with chronic kidney disease, especially those in advanced stages. It has been observed that sodium bicarbonate can help maintain the acid-base balance, reduce the rate of kidney function decline, and improve nutritional status by reducing protein breakdown in the body. Potential risks of sodium bicarbonate. However, despite these potential benefits, it is crucial to approach sodium bicarbonate supplementation with caution. The National Kidney Foundation and other health authorities emphasize the importance of medical supervision when using sodium bicarbonate. This is because improper use of sodium bicarbonate can lead to several side effects and complications, including 1. Sodium overload. Excessive sodium intake can lead to fluid retention, increased blood pressure, and swelling. This is particularly concerning for individuals with kidney disease who are often advised to limit sodium intake to manage blood pressure and prevent fluid buildup. 2. Electrolyte imbalance. Sodium bicarbonate can alter the balance of electrolytes in the body, potentially leading to imbalances such as hypokalemia, low potassium levels, or hyponatremia, high sodium levels. These imbalances can have serious health consequences and need to be monitored closely. 3. Alkalosis. Overuse of sodium bicarbonate can cause metabolic alkalosis, a condition where the blood becomes too alkaline. Symptoms of alkalosis can include confusion, tremors, muscle twitching, and nausea. Given these risks, it is essential to only use sodium bicarbonate under the guidance of a healthcare professional. Your doctor can determine the appropriate dosage and monitor your health to ensure that the benefits outweigh the risks. They can also advise on alternative treatments and dietary modifications that may help manage metabolic acidosis and improve kidney health without the potential side effects associated with sodium bicarbonate. In summary, while sodium bicarbonate can be a useful tool in managing certain aspects of kidney disease, it must be used with caution and under professional supervision. Always consult with your healthcare provider before starting any new supplement to ensure it is safe and appropriate for your specific health condition. Consultation with your doctor. Managing kidney disease requires a comprehensive and personalized treatment plan developed in close collaboration with your healthcare provider. This plan typically includes dietary changes, medications, regular monitoring of kidney function, and lifestyle modifications tailored to your specific health needs and the stage of your kidney disease. Taking proactive steps to manage kidney disease can significantly improve your quality of life and slow the progression of the condition. By working closely with your healthcare provider, you can develop a personalized treatment plan that addresses your unique needs and concerns. Don't hesitate to reach out to your doctor with any questions or uncertainties you may have about your diet, supplements, or treatment options. Your health is worth the effort, and with the right support and information, you can make informed decisions to enhance your kidney health and overall well-being. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment great to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you.